What is polio disease and what is it contagious? Polio or polymyelitis is a disabling and life-threatening disease and caused by poliovirus. The virus spreads from one person to another, so it is contagious. The virus spreads from one person to another and can affect a person's spinal cord. Poliomyelitis is a infectious viral disease that affects the central nervous system, which is in the brain and spinal cord, and can cause temporary permanent paralysis. Paralysis means people who can't move certain parts of their body. Where is the polio disease first discovered, and how did they discover it? Its first outbreak epidemic form was discovered in the U.S. environment in 1894. Who discovered the virus, and how was the virus like? Was it a small virus, or was it big enough able to see? Was it a bacteria? The people who discovered it was Carl Lanster and Erwin Popper. Discovered poliovirus disease, and they discovered and said that it was not a bacteria and it was a small tiny virus. Who was mostly likely to catch this viral disease, and what percentage of people affected by this viral disease globally, and especially in the Middle East? Polio mainly affects children under 5 years old of age, and it affected countries in more 350,000 countries in more than 125 countries, epidemic countries. How did the poliovirus disease affect the Middle East and its surrounding? It affected the Middle East and surrounded in Iraq, and it began in Syria, and 2013 it spread to Iraq. What were the symptoms of this virus? The symptoms included were fever, vomiting, fatigue, headache, fatigue which means weakness in the bones, stiffness in the neck, and pain in the limbs, which leads to irreversible paralysis, which means usually in the legs. It means that they can't really and properly move their legs properly or control them. It also invades the nervous system, which includes the spinal cord and brain, in a matter of hours. What were the diagnoses of this disease? Doctors used some treatments to their patients, like pain relievers and muscle exercises. Was this virus contagious, infectious? Yes, it is infectious, and the virus can spread from one person to another. Can animals have this disease? Yes, monkeys have this disease, but it only affected a monkey, most of the monkeys. Is there a vaccine for poliovirus? Was there a vaccine for poliovirus? Yes, there was a vaccine, and it succeeded. How did a person really how did he train for his normal life? Did he have a daily life affected by this disease? The person who should really treat himself good and with this disease, or to affect and to prevent the disease coming towards him, they should keep distance between each other and have a balance, and nutrients should be taken, and a good night's sleep and rest should be followed by a doctor, or you can make a schedule or some kind of schedule you can make for your sleeping. That would be very nice also. So there was also a kind of disease that was called mad cow disease. What is the mad cow disease? The mad cow disease is known as the bovine spongiform. They call it a bovine spongiform. Okay, so what is mad cow disease and what is its name from? The mad cow disease is transmissible and fatal disease affecting the central nervous system as the poliovirus, but it affects an adult cattle, or in other words called cows. A cattle is a cow. What may have caused this horrible, dangerous disease? Well, it's caused by eating beef products contained with central virus nervous system, such as brain and spinal cord, from cattle infected with mad cow disease. Who discovered the mad cow disease? A German neurologist, Hans Gerhard Siegelwald, in 1920, in a 23-year-old woman. Where was the mad cow disease discovered? The mad cow disease was first discovered in the United Kingdom, in England. Countries like United Kingdom, France, Austria, Belgium, Germany, and Italy, and more were the most countries that were affected badly by the mad cow disease. What were the symptoms of the mad cow disease? Symptoms of this disease included muscle stiffness, involuntary muscle movements, dementia, which is a loss of memory and unable to remember anything, and seizures. There were several diagnoses for this disease. One was imaging such a MRI and PET scan. This was also very helpful. Certain lab tests may be performed to rule out other forms and causes of brain dysfunction. This caused the brain to not dysfunction very normally. The mad cow disease was not contagious. The mad cow disease is an infectious disease. It was contagious, caused by prions that affects the brains of cattle. Abnormal proteins that affect the brains of cattle are found in the brain tissue of diseased cattle and appear to be the particle that transmits the disease or the infection. The mad cow disease can affect animals like cows, deer, sheep, fish, and cats. There was no vaccine for the mad cow disease, but there are drugs and that can help relieve muscle spasms and twitches, such as sodium valproate and clonazepam PEP. They used these drugs or medicine to relieve pain for the infected person that had the mad cow disease. So the mad cow disease can be transmitted by eating the central nervous system of cows. You could prevent it coming to you by minimizing or avoiding meat or beef consumption, as you can say, tuna that is in the can. There were meat that was like that in the can. So you can prevent the disease coming to you by preventing meat consumption and avoiding meat eating a lot. It may affect a person's life by making a person unable to remember things, and may lead to depression and personality and behavioral changes. It can affect a person by making the person doing unnormal things and acting very unnormal, and it can control of its ability to do normal things. This infection causes its brain to waste away and become spongy. Many people believe that this disease comes from certain type of food given to cows, and that some of this food contains the remains of the dead cow that had the infection. Thank you.